After the lumbar puncture was done, results showed that the patient had meningitis and he demised at the hospital. So our cause of death will never say TB, we'll say meningitis. How do we work around such issues?
To many family members and living claimants, it is extremely complex and frustrating administrative process that has led many eligible claimants to simply give up the fight. Following a flurry of calls and complaints, Lesotho Social Cluster Committee has decided to intervene, led by a chair of chairs, an ex-miner himself.
So I was working in Klerksdorp, Buffelsfontein, Pioneer Hostel number 1.
The Social Cluster Committee has called all stakeholders in one room to get a first-hand account from both victims and technocrats. One of the claimants describes how angry he got after being verbally abused by one of the officers. On this second occasion, I came in possession of a weapon. I swear I told myself that should this boy try that again, I'm willing to go to prison. This is my own life, sweat and blood. And indeed, as I entered, he said, "You are here again." The security guy noticed the altercation and intervened. I was ready to deal with this boy. Indeed, my father's was written natural causes, but the documents he came home with showed he had a second-degree silicosis and must therefore be discharged due to incapacity. But if I may ask, so for as long as death certificate says natural causes, where will that benefit ultimately go? It looks like there's a deliberate attempt to frustrate this claiming process in order to return as much money as possible to the mining coffers. But to those running the process, they believe there is currently no need for panic and urged Basotho to familiarize themselves with eligibility criteria.
Let's appreciate the work that has been done in the past 4 years since the trust started operating, to have paid more than 800 million to the Basotho people.
The claimants are seeking for a speedy and transparent process, and this committee is looking for solutions from all stakeholders.
First and foremost, my proposal is that whether through the parliament as a strategic instrument of the state at oversight level, or the parliament compelling the two ministries, health and labor, let us have a constant platform of convergence.
The process is frustrating because, first of all, Basotho are not ordered with keeping documents or the records. But Tshiamiso can make things easier if they want to, because personally I work at the hospital. I know we keep records for our patients. If they really want to assist, they'll just go to the hospital mines to inquire those medical examinations.
What role should the parliament play in this process? What the role should the ministries play? What role should the ex-miners association play? What role can Tshiamiso and MBOD play and the government of South Africa in terms of those who are involved? So it has been very clear how we can move forward and make it easier for ourselves, but not only for ourselves, but also for the region.
I'm Rapelang Khatebe for SABC News, Lesotho.